Hello, this is Davide Restaurant. Before we talk about respiratory assessment, let's understand something very important. How do your lungs actually work? Let's break it down. First, your lungs want to collapse. Your lungs are elastic. Think of them almost like a stretched rubber band. They naturally want to recoil inward. But your chest wall tend to pull outward. So we have two opposing forces. Lungs pull in, chest wall pulls out. And between them, we have the pleural space. The pleural space. Your lungs are surrounded by two membranes. The visceral pleura covers the lung itself, and the parietal pleura lines the inside of the chest wall. Between them is a thin space, the pleural space. There's only a small amount of fluid between this layer. Think about two wet pieces of glass pressed together. They can slide, but they are difficult to pull apart. Something similar happened between the pleural surfaces. And here's the important part. The pressure inside the pleural space is normally negative relative to the atmospheric pressure. This is called intrapleural pressure. Let's talk about the pressure. We can use atmospheric pressure as our reference point. Let's call it 0. At the end of normal breath, the pressure inside the alveoli is approximately 0. But the pressure inside the pleural space might be approximately -5 centimeters of H2O. So, atmosphere 0, alveoli 0, pleural space -5. That difference between the alveolar pressure and intrapleural pressure can create what we call transpulmonary pressure. And the pressure difference helps to keep the lungs open and expanded. Now, take a breath in. Here's something interesting. Your lungs actually don't suck air in. Instead, your diaphragm contracts and moves down. Your chest expands. That increases the space inside your thoracic cavity. As the chest expands, the lungs expand with it. And remember, more volume means lower pressure. So the pressure inside the alveoli drops slightly below atmospheric pressure, maybe around -1 centimeter of H2O. Outside the body, 0. Inside the alveoli, -1. And air follows one incredibly important rule. Air moves from higher pressure to lower pressure. So where does the air go? Into the lungs. That's inspiration. What happens when you exhale? Now the diaphragm relaxes, it moves upward, the chest becomes smaller, the elastic lung naturally recoil. Now we're doing the opposite. The volume inside the lungs decreases and the alveoli pressure increases slightly, maybe +1 centimeter of H2O. Now we have inside the alveoli +1, atmosphere 0, and remember the rule, air moves from higher pressure to lower pressure, so now the air moves out of the lungs. That's expiration. And during normal quiet breathing, expiration is mostly passive. The elastic recoil of the lungs help push the air back out. So let's go over the sequence one more time. When you inhale, the diaphragm contracts, the chest expands, the lungs expand, the alveolar pressure decreases, air moves in. When you exhale, the diaphragm relaxes, the lungs recoil, lung volume decreases, alveolar pressure increases, air moves out. So what happens if air gets into the pleural space? Now things get interesting. Remember, the pleural space normally has negative pressure. That pressure relationship helps to keep the lung expanded. But imagine something punctured the chest and air enters the pleural space. Now the negative pressure starts disappearing. The pressure moves toward atmospheric pressure. Remember what the lungs naturally want to do? Recoil inward. So the lungs began to collapse. That's a pneumothorax. I'm sure you have heard about this. And this is why we use a chest tube. If air enters the pleural space, we need to get the air out. And a chest tube can remove air, blood, or fluid from the pleural space, helping restore the pressure relationship and allow the lungs to re-expand. That's also why the chest drainage system uses water seal. We want air to leave without simply following back into the chest. One last thing, everything we have talked about describes normal breathing. This is called negative pressure ventilation. Your chest expands, pressure inside decreases, and air flows in. But mechanical ventilation can work differently. Instead of creating negative pressure around the lungs, the ventilator creates positive air pressure and pushes air into the lungs. Now they understand all of this, respiratory assessment, pneumothorax, chest tube, and mechanical ventilation start making a lot more sense. This is Davide with Questor N. Please like and subscribe for more of this content.